Hi guys, welcome to 20 OBG instruments under 10 minutes part 2. If you haven't watched the part 1, please go watch the part 1 video. Let's start. Which of the following instruments are used for cesarean section? It is a PYQ innocent question. The answers are it is green Armitage forceps is used, Alice forceps is used, Doyne's retractor is used, and a BP blade is used. Kaman's cannula is used in MTP. Schrodker's retractor, there is no such term. Schrodker forceps, it is used in cervical cerclage. If you want to know the photos of these instruments, you should check out the part 1 video. Very simple, episiotomy scissors. What forceps is this? There is a Wrigley's forceps, which is a type of an outlet forceps. Which forceps? See this pelvic curve? There is Piper's forceps, which is used in aftercoming head of breech delivery. This is Bonney's myomectomy clamp, which is used to clamp the uterine vessels of pedicle during myomectomy to control bleeding. Which forceps is this? Check this specific lock. Yes, it is a Killan forceps. Specialty of Killan forceps is that it has this specific lock and it facilitates a rotation. Hence, it can be applied in unrotated vertex. The instrument used in which procedure? It's a PYQ. That is a laparoscopic sterilization. It is a fallopian ring applicator which is used for laparoscopic tubal ligation. So from here you can apply the rings, celastic rings into the fallopian tubes, and thus it can be used for laparoscopic tubal ligation. Identify the image. Which speculum is this? This is Cusco's self-retaining speculum. Let's go through other options. What is Sims speculum? This is Sims speculum. It is a smooth blade. Other type of retractors. This is Cerndy's retractor. Smooth curved is Deaver's retractor. L-shaped is Langenbach's retractor. L-shaped with a hole is Maury's retractor. Curved with a hole is Doyne's retractor. This is Balfour's retractor. If it has this sharp blade at one end, it is Perkins' retractor. This is Job's self-retaining thyroid retractor. Again a question on laparoscopic fallopian ring applicator. See, this is how we apply the elastic rings into the fallopian tube, and thus it is used in laparoscopic tubal ligation. A 38-year-old woman with uterine fibroids is scheduled for surgery. Surgeon uses the instrument shown in the image. What procedure is the instrument most used for? Which instrument is this? This is a Bonney's myomectomy clamp, and it is used in open myomectomy surgery to control the bleeding. Another instrument used in open myomectomy is myoma screw. So it has this screw. These two instruments need to be remembered. Fixative used in pap smear. 10% formalin or 95% alcohol, normal saline, air drying. The answer is 95% ethyl alcohol. The instrument below is used for which of the following procedures? What is this instrument? This is Ayer spatula, and it is used for pap smear, and it takes the sample from transformation zone. Identify this instrument. This is an endocervical brush, also called as broom, which is also an instrument used in pap smear. This is Ayer spatula used in pap smear, cervical brush or the cervical broom used in pap smear, and if it has this cone shaped at the end, it is a cyto brush which is used in liquid based cytology, not in pap smear. Again, see this cone shaped end, that means it is a cyto brush. It is used for liquid based cytology. What is the order of steps involved in taking a pap smear? First, you should position the patient in lithotomy position. You should not do a per vaginal examination, and then you retract the posterior vaginal wall with a Sims speculum. Then using an Ayer spatula or cyto brush, collect the sample, smear the sample onto the slide, fix it with 95% ethyl alcohol, stain and visualize. So the answer would be 4, 1, 3 and 2. Outlet forceps is applied at which station? As outlet forceps means the head of the baby is nearly out. So the head should be on perineum. Outlet forceps are used when the fetal head is at the outlet of the birth canal, which means head is visible at the perineum. This typically corresponds to a station of +4 and +5, depending on system use, but head on perineum is the most accurate description. Which forceps is used here? Check this pelvic curve and also see that the baby is in breech position. This is the aftercoming head of breech, and the forceps used is Piper's forceps for aftercoming head of breech. Identify the retractor, smooth shaped bleed. That means it is a Deaver's retractor. Identify these instruments and its use. The first one is Rubin's cannula, second one is Leach-Wilkinson cannula. Both are used for injecting dye while performing hysterosalpingography. Which instrument is this? It is a Pinard fetoscope. It is like a fetal stethoscope. That's all. We finished the whole deck in 6 minutes. Thank you.